Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Mary Washington Healthcare and the Rappahannock Area Health Department are committed to improving the health of the people in our community. We take this commitment seriously and know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we are here to share what we know about COVID-19 and what we are doing to keep you safe and healthy, especially as we near the holiday season and winter months. During this town hall, you will hear from our expert panel and welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Dr. Denise Bonds, Acting Director for the Rappahannock Health District, Virginia Department of Health. And our third panelist is Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. Dr. Bonds, I'd like to turn it over to you to start the program and tell our viewers the latest information regarding our district.
Sure. If we can show the slide showing our current numbers, that would be really helpful. So here you see new cases by date, and I think the really important thing to show here is that our rate is now at its highest level really since the beginning of the pandemic. Just recently we had over 142 new cases reported, which is really our, as you can see, our all-time high. We know that these numbers are going to continue to increase because of the recent holidays, and we expect actually to continue to see a rise with the winter months. If you can show the next slide, please. So here you see the cases per week in November, and there's been a 136% increase over the month. At the beginning of the month, we had 291 cases for the week of November 7th, and the week that just finished up had 687 cases. Really a very dramatic rise and quite worrisome for our healthcare facilities, as we'll see. Can we have the next slide, please? Our percent positivity has also been rising. We're nearly at 10% for the health district right now. And I do want to point out, we saw this very substantial positivity rate very early on in the pandemic, but I just want to remind everyone that early on, it was really difficult to get testing done for individuals who were symptomatic. So we were focusing our efforts in testing on those who had the most severe symptoms, which meant that we had pretty significant positivity rates. Now, as you can see from the blue bars in the background, we actually have pretty widespread testing, as we'll talk about later on tonight. And so the fact that our percent positivity is rising is quite concerning given the wide availability. You can see by locality that Stafford is now over 10% positivity, Spotsylvania is at 8, King George at 9, Fredericksburg City just under 7%, and Caroline at 4%. Can we go to the next slide, please? So in the coming months, we are expecting to see increasing spread, as I said. With the cold weather, people are spending more time inside. With the holidays, people are spending more time socializing with individuals outside of their immediate social bubble. We really need to protect ourselves by following all the precautions that we've been talking about throughout the pandemic, keeping our physical distance from each other, wearing masks all the time, washing our hands and high-touch surfaces frequently, and staying home and staying away from others when we're sick. We do have some good news on the horizon that we can talk about tonight. The vaccine should be approved sometime in the next few weeks for emergency use, but it won't be widely available for everyone. It'll really be focused on healthcare workers and long-term care residents. So if we can go to the next slide. So as I said, wear a mask, maintain your distance, avoid indoor gatherings. We know being outdoors is safer. Stay home if you're sick and wash your hands frequently. Really, it's critical that we all continue to practice these measures to protect each other and ourselves. We're all having a little bit of COVID fatigue, but I think it's really critical that we keep up with our 4 measures that we see here.
Thank you, Dr. Bonds. Yeah, thank you for your introduction and introducing us to the numbers that are happening here in our community. Dr. McDermott, would you be able to talk to the numbers that are happening here for Mary Washington Healthcare?
Yeah, I'd like to do that. First, I want to thank everybody for taking a little bit of time out of your evening to tune in to our town halls. You know, we ran a series of these in the spring and summer for everybody when COVID was just starting, and we were trying to keep our community very informed with what was happening. And at that point in time, we talked a lot about flattening the curve. There was so much uncertainty. The cases were starting to increase around the country, and we implored everybody to take action at that point in time so that the number of patients that we were seeing with disease, it was going up every day. We needed to flatten the curve and make it not on such a steep slope. And so I have in front of you a little bit of our data that we've seen from the beginning of the pandemic. A couple of lines I want to point out and walk you through. First, there's a yellow line in here, right? That yellow line is the number of positive patients that we're treating for COVID-19 in our hospitals at Mary Washington and at Stafford Hospital, really from every day all the way from March till now. And I want you to come over to the right side of the screen there and look at November 1st, when we had approximately 15 patients that we were caring for between Mary Washington Hospital and Stafford Hospital. And look what has happened to that line from November 1st until now. And the slope and the increase in that line really throughout the entire month of November. The steepness of that slope, it's never been higher. The line on top of that, the orange line, that's the number of hospitalized patients in the whole state of Virginia. And you can see from the beginning of November as well, that slope is also very, very steep. And so it's why we started these town halls again, is to make everybody aware, hey, the prevalence of COVID-19 in our community has never been higher. And there are more hospitalized friends, family members, and loved ones in our hospitals right now that are trying to fight COVID-19 than we've ever had at any point of the pandemic. And so we are imploring everybody again to take action to flatten the curve. We have to start talking about that again. We can't have the slope go up like it's going right now. We need to flatten the curve. And the good news is, throughout the course of the pandemic, we know more. We know the things we have to do, the things that we can do, each one of us, to flatten that curve. And that is, everybody needs to wear a mask, right? Wear a mask. It protects you and it protects others around you. Social distance, right? Extraordinary hand hygiene, right? And right now, at this point in time, with the positivity rates like we have, stay home if you can, right? Stay home. Don't be around others at all, right? That will really decrease your risk. Stay with your home unit who lives in your household, right? Those are things we can all do to flatten the curve. And so everybody here who's tuning in tonight, I know you're very interested in seeing what's going on. You can spread the reach, though, of the message that we're giving today, right? Everybody can talk to 2 or 3 friends and say, hey, I tuned into the town hall last night. Cases have never been higher. There have never been more hospitalized patients in our Rappahannock region than there are now. We need to all take action and take steps to flatten the curve. And that's what I'm asking everybody to do here today. Currently, we have 60 patients hospitalized between Mary Washington and Stafford Hospital that we're caring for. It's never been this high. We've never had this many hospitalized patients in our community that have needed care to help them battle COVID-19 in the hospital. So we're imploring everybody, let's keep, we also talked a lot in the spring, keep this within our capacity to make sure everybody can get fantastic care. And so in order to do that, we need to flatten the curve at this point in time. And I would appreciate everybody who's taken the time to listen tonight, if they could help us spread that word in our community. Take steps to flatten the curve, wear a mask, stay at home if possible.
Thank you, Dr. McDermott. Dr. Newman, can you talk to us about what's happening with our workforce and here at the hospital?
Yeah, our workforce is getting weary. This has been a very, very long battle, since early March that we've been undergoing. And it's like I said, the analogy is like everybody has just finished running a marathon, and now they're being told that was just the warm up. So our healthcare providers are working so hard for our community, but they are getting exhausted. And the curve that Dr. McDermott showed is unsustainable. We cannot sustain that growth in hospitalized patients here in our region. One of the most important aspects of flattening that curve is preventing a health system from being overwhelmed. If we are overwhelmed, we're not going to be able to take care of you when you come here for COVID or any other reason you may need health care. If we overwhelm our health system, we're going to be watching, just like we watched what happened in Italy and what happened in New York City. We do not want that to happen in Fredericksburg, and we are getting very, very close. We have many, many very sick patients, ventilated patients, most patients with COVID in our ICU that we've had since the beginning. And and this trajectory is just absolutely unsustainable. So really, for the sake of our healthcare workers and our community, so that we're here to be able to take care of people, this is the time to flatten the curve. It's very serious.
Thank you. We've had a community question that I think speaks to that, Dr. Newman, is how do these inpatient numbers compare to the capacity of the hospital? In other words, how close are we? We've seen in the news that the mayor of Los Angeles has said we may reach capacity, their hospitals may reach capacity by the end of this month. What does that translate here?
Yeah, our ICUs at Stafford Hospital and Mary Washington Hospital are at capacity. And this is not about ventilators or building more beds or field hospitals. This is about ICU nurses and physicians that have the training and the capability, respiratory therapists, to be able to adequately take care of you. We are at that capacity now in our ICUs and system and healthcare system. And if we continue on this trajectory, it will not be sustainable.
Do we have a plan on how we can add more ICU beds if necessary?
Yeah, we have contingency and surge plans in place where we can utilize other staff, as we've talked about in the spring, anesthesia, OR staff, and others that can lend a hand and help out as we utilize other parts of our hospital as ICU. But that is not ideal. That's not going to give people the ideal outcomes that we have been really having here as a health system to keep the mortality rate low and provide adequate treatment for everybody. So, I do have concerns. And again, everybody had more energy back in March and April. This has been a very, very long, hard battle. And this is not the time to overwhelm our healthcare providers. So it's very, very hard. I think there's fatigue, as Dr. Bonds had mentioned, with the social distancing and isolation. And I think everybody, I know somebody who's had COVID, they got better, it wasn't that big a deal. But the odds are not always the best there. You do not want to play that odds game. And if hundreds and hundreds and hundreds of people in our community become positive, yes, many will get better, many will be fine, but there's a percentage of them that will require hospitalization, that will get very ill and will die. And we're getting to that point where our healthcare system here locally is getting overwhelmed.
And it could be you, right? If you get COVID, you could be the one who decompensates and requires hospitalization to help you fight COVID-19. We can't predict who's going to require that care or not. And I think it's very important, that what Chris is speaking about, people know, well, we have 400 some hospital beds in our hospital, but those, a lot of areas of our hospital are very customized to treat very specific types of disease. And the individuals and healthcare workers that work in those areas have a very specific expertise. We cannot care for 400 hospitalized COVID patients that require intensive care unit care. We can't do that. We don't have the expertise to do that. And so we need to keep that in mind. That the trajectory we're on right now, it's why we've restarted these town halls. It's unsustainable, and we can take actions. This is the thing, we can control it with our actions and our activities as a community. And if we all take actions, limit our activities around others, always wear masks, we can flatten the curve. It's something, it's within our control. And that's why we have to raise the word, spread the word. Everybody who's tuned in tonight, talk to 4 or 5 others, tell them about this, why it's important right now to take action, especially we know we had the Thanksgiving holiday gatherings. Those aren't even factored into our numbers yet. And we're looking into the Christmas season and times when I know it's natural for people want to spend time around others. We have to resist that based on the data. and in order to keep everybody safe.
And add to that, Dr. McDermott, it's also starting flu season. One of the questions we had is, our seasonal flu line that's on that graph seemed a little flat. What is happening with flu? And are we concerned about that?
Yeah, Chris, I don't know if you want to take this.
Yeah, we are starting to see flu cases now starting to come into the hospital. I think we're not seeing probably the peak that we normally did because we are masking in our communities and those kind of things. And I'm really hopeful that a lot of people chose to get the flu vaccine. And if you haven't, it is not too late to get the flu vaccine because that would be one added problem to overload our health system. Is if we see a flu surge at the same time as we're seeing a COVID surge, it could be catastrophic. So that is something that we can do and prevent, and there is a vaccine readily available for that at this point.
And another piece of good news there is we know the same actions we take to prevent catching COVID are the same actions that will help us prevent catching influenza as well, right? If we wear masks, if we stay at home, limit interactions with others, it also limits our chance of catching influenza, right? And so same tactics, we can fight these two diseases at once.
Thank you. One of the clarifying questions we had from our audience is that we all understand that wearing a mask is critical to flatten the curve and stop the spread. Should we be thinking about masks outside, not just indoors?
I wear a mask outdoors. I wear a mask outdoors, and I think that we should. There's this idea that there is better dissipation in outdoor environments of the air and circulation. Those things are true, but there's masks provide a level of protection when you're in any environment around others, right? And so I would encourage everybody to wear a mask in those. Right? It also sets a good example and is a good message to others that you care about them, right? You not only care about yourself, but you care about them. If for some reason I was spreading COVID-19 by wearing the mask, I'm going to be protective of others around me as well. And so I think it's scientifically sound. It also sends a good message, and I encourage everybody to wear a mask at all times if you're going to be around others that are outside of your daily household unit.
Another question that has come in for clarification with our COVID numbers, they see the 60 COVID plus hospitalized patients here in our COVID positive here. Are they all in the ICU is the question.
No, they're not all in the ICU, but we are now in double digits in the ICU, and our number of patients requiring ventilation or high flow oxygen are increasing by the day. So those are the patients that require the really higher level specialized care for which we only have so many physicians and nurses and respiratory therapists trained to be able to provide that level of care. And that's what becomes difficult. And the number of beds of the hospital system, as Mike said, it is a little bit confusing to people because we have a labor and delivery unit. That is not a unit that's going to be providing COVID care. We have other units in the hospital that are very special, a neonatal intensive care unit, and others that have very subspecialized needs. They are not for sick adults, and that's that requiring very high levels of care. So we are getting overwhelmed on that capacity.
Thank you. Dr. Bonds, we have a question here that I'm hoping you might be able to address. We're seeing teachers test positive pretty regularly here, if not daily, and it's scary for our community. How do we flatten the curve while school is still in session?
So that's a really great question. What we've seen is school districts like Spotsylvania and Stafford that have instituted really good mitigation measures where they have the number of kids that are in the classroom at any one time by having a hybrid model. The kids are all wearing masks all the time. The teachers are wearing masks. They've spread it out. They've limited interactions. That's really meant that we haven't seen school transmission. Now, we do see positive cases, but when we investigate those, we find that almost always they originate outside of the school. So it's an activity that either the student or the teacher did outside of the school setting. So I think that really goes to show that having the kids in the classroom is not the dangerous activity. It's what they're doing outside of the classroom and then bringing into the classroom that is. And if we stop schools, One, our younger children don't get the interaction that they need. It's really tough for younger kids to learn over a Zoom link. And second, those kids are going to have to go and do something. And the likelihood is that they're going to participate in an activity that's even higher risk and not nearly as structured and doesn't have the same mitigation measures. So I know that people feel like it's really worrisome, but in fact, I think the kids are in a pretty safe environment, and the measures that I've seen schools take really make me confident that they're mitigating the risk for those children when they're in the classroom.
Thank you. I'd like to switch over to testing. We've had a question about testing of if you get tested multiple times and each time it's been positive, does that mean you're counted as a positive case multiple times?
No, in fact, we're only going to count you the first time that you test. And we know that for often 90 days after your initial positive test, you can continue to have that positive PCR test. It doesn't mean that you're contagious, and it doesn't mean that you still have an active case of COVID-19. The test that we use, the PCR test specifically, looks for the virus's RNA particles. And we know that there are some individuals that just continue to shed those dead particles for a very long time afterwards. So in fact, if you test positive and you go through your isolation period, we don't really recommend that you get tested again after that for 90 days or so because of the false positive rate. So our numbers are really unique individuals.
Thank you. Switching over to some more hospital questions, are we considering changing our elective surgery cases, either limiting or canceling?
Yeah, we've been making those plans this week, and very serious concerns about having to do that. I think when people hear elective, they think it's unnecessary or really not that important, but that's not the case. We're talking often about cardiac surgeries, vascular surgeries, cancer surgeries, preventive measures that are really critical for wellness and health and better health outcomes. And when those are delayed, it gives me concern. So that's another reason why we need to keep everything within the healthcare system's capacity to care for our community. But unfortunately, we are having to start to have those discussions. We are hopeful that we will not have to just do a blanket shutdown of all scheduled procedures as we did previously. And we have our medical staff and operational leaders and nursing staff and OR staff looking at the cases for the week and seeing which are the safest to maybe delay a week or two and which are not, based upon what our capacity is for that week here in the health system. So we're being a little more surgical and strategic about it than we were previously, but it does give me concern. And what we saw in October were record number of ICU cases that were non-COVID. And what we found, and that's here and across the country, and what we found is this is from people who delayed care. They were either afraid to come to the health system or they had delayed care because of COVID, and they're finally presenting at advanced stages of illness. We're seeing more stage 4 cancers at presentation, advanced cardiac situations that normally we would not see. So on top of all those very sick people coming in who had delayed care, now we're seeing a surge of COVID, and it's really adding up to a lot of stress on the health system.
And what about the field hospital? Is there a chance that we could end up activating it now that these numbers are growing so quickly?
Well, remember, we constructed the field hospital to allow some flexible space for us in the midst of this pandemic, and it could be used in a variety of ways. But this is why we're having these town halls tonight, right? Because we're at a point now where we're saying to everybody, we need to flatten the curve so that we don't have to activate ancillary space like the field hospital to help us provide care for members of our community. If we do that, whether it's for triage or for treatment, we've gone beyond a point where we really want to be as a community. And so we're imploring everybody to take action now so we can keep all the hospitalized patients that require care within our capacity to care for everybody in the best way possible. And so that's why we're imploring everybody, we can control this as a community. Let's all take action now to do that by wearing masks, limiting our activities around others.
Thank you. And one of the questions for clarification on our on proper protection. People have been seeing mentions of maybe wearing safety goggles, and that transmission can happen outside of the respiratory center. So is it make sense for people to be thinking about safety goggles?
We've had some questions about this, and you see sometimes people wear a face mask or shield that's just plastic without a mask. They just wear a face shield. The most important thing you need to do is cover your respiratory organs, and you have two of them on your face. One is your mouth and the other one's your nose. And so when you wear a mask, you need to wear it over and cover those respiratory organs. Your mouth and your nose need to be covered. That's what inhales and exhales air or coronavirus, and it's your biggest risk of catching coronavirus or transmitting it to others. Face shields add another level of protection if you're going to get splatter in your eyes. A lot of our medical personnel wear face shields in the midst of their job duties and things like that. But the most important thing that you can do to protect yourself and others around you is you need to wear a mask, and it needs to cover both of the respiratory organs on your face. Not like this. This is wrong. You see a lot of this around. It needs to cover both. That's the proper way to wear a mask for your protection and for the protection of others around you.
Yeah, healthcare workers in close contact with caring for COVID patients who may be coughing and secreting. That's who I worry about having face shields and goggles. Out in the community, it should be 6 foot social distancing and a standard mask. I don't advocate, and I don't think a face shield does not replace a mask. I think it's another. I've sometimes seen people with an upside down face shield that doesn't prevent the respiratory secretions from getting out like a normal face mask. So it's not a replacement.
I'd like to go back to some testing questions. One here is, will we plan to start testing every patient that comes in so as to reduce the risk of any unknown cases being in the hospitals?
Yeah, we had been doing that at one point. I would say we are testing a very large number of patients. Based on current science and our experience with COVID at this point, we are testing people undergoing high-risk procedures where there may be a high risk of transmission if they're asymptomatic, individuals from congregate living settings where there's a higher risk that they could be COVID carriers, and that could either be a college dorm room, a prison, or a skilled nursing facility, but those kind of things. And then anybody with a suspicion of symptoms, we are testing. Otherwise, we're taking a universal precaution approach within our health systems. Everyone is masked. Patients are masked. Our associates, our healthcare providers are masked, and we have not seen transmission of patients to our staff for a very long time, actually, in this pandemic, because we now understand and we're protecting people.
And how would people go about getting tested if they've been exposed to someone with COVID-19? Should they get tested right away? Should they delay? And where do they go to get that testing?
So the health district offers a whole series of free testing, and we actually have a slide with the most recent events if you want to bring that up. The testing is free. This is the PCR testing, so it's a swab that'll go up your nose, and then we send it off. We usually get the results back in 2 to 3 days. We use our state lab. So you can see we have testing tomorrow night, Saturday, next Monday, Wednesday, and Friday. So lots of opportunities to get tested over the next few weeks. You can go to our website down there and find the schedule. You can also find the form to pre-register. You don't have to pre-register. You can show up there at the time of the event, but it certainly is easier if you pre-register. So if you've been exposed to someone, if one of our contact tracers, for example, calls you up and says, you have been identified as someone who is a close contact, we need you to go into quarantine, people often ask when they can get testing. And the answer is usually not immediately after your contact. So when you inhale those COVID virus particles, it takes a little bit of time for your body to absorb those particles, as it were, into the cells and develop an active infection. So what we really recommend is that people wait a few days if you're asymptomatic, and get your testing done somewhere in that 5 to 7 day range. Now, if you get any symptoms that are consistent with COVID, you should go and get tested right away. You should not wait to get tested if you have symptoms. But if you're asymptomatic, then somewhere at that 5 to 7 days will be the best time to get tested to kind of determine if you're going to be one of those asymptomatic cases.
Thank you. And Allison, I'd like to pose this question to you. We had a question come in on the numbers. Do we have the per capita numbers for cases that we've provided absolute numbers, but what are the statistics within the overall community? And if they come into contact, say with 100 people, how many people would likely be positive?
Laura, that's a great question because I think it can be really challenging to compare the numbers between our localities since they have very different populations. We know that Stafford and Spotsylvania are much larger than the other 3 localities in the health district. What we'll go ahead and do, since I unfortunately didn't prepare a slide with that, we'll drop the link where folks can find that on the VDH website. It's very accessible and it gets updated day by day. But I think that that's going to be the best way to go about that tonight.
Thank you. Now, Dr. Newman, I'd like to ask you about treatment options. We always get the question of how are we treating patients? Do we have the latest treatments? We recently started a new treatment program here at Mary Washington Healthcare. Can you talk about that?
Yeah, so we have a new treatment available, and it's called monoclonal antibodies, and you've probably heard about this in the news. One of those they're calling BAM, or it's bamlanivimab, and another is from a company, Regeneron. So we now have 2 different medications that we are starting to receive. We are receiving these medications through the state. So who is a candidate for these medications? These medications are a little different than what we had before. Most of our other treatments have been geared to those who are very sick and in the hospital. These medications need to be given early in the disease. So within 3 days of having a positive test and within 10 days of symptoms, and prior to being sick enough to have to go to the hospital or prior to needing oxygen. So these medications sort of boost your immune system and attack the virus to prevent you from getting very ill if you develop COVID symptoms. So who are candidates for these medications? Well, it's the typical high-risk individuals we've been talking about. So anybody over the age of 65 is a candidate for these medications. Those that are immunocompromised or on immunosuppressants at any age, including children. Those children with sickle cell are candidates. Other candidates would be diabetics, people over the age of 55 with heart disease, COPD. There are a lot of very specific criteria, but if you feel you're in a higher risk category and you test positive for COVID and you start developing symptoms, do not wait. We now have a treatment that may save your life, may save you from being one of these patients very ill in the hospital. So you need to contact your primary care physician. We're sharing information with all the primary care docs within our region so that they know how to get this treatment at either Stafford Hospital or at Mary Washington Hospital. If you do not have a primary care physician, you can seek an urgent care because, again, there's a time sensitivity. You can't wait days for an appointment. When you're feeling ill and you're in a high-risk category, make sure you're tested and make sure you're inquiring if you're a candidate for one of these medications. And if you don't have insurance and you're worried you're not able to pay, that is not an obstacle either. We will work with you. These medications are being provided to us free of charge from the state at present. And we will work with you. If you're worried that you don't have a primary care doctor, you can see one of the 2 urgent cares of Mary Washington Healthcare. We will help you and we will make sure you get the treatment if it's appropriate. And we currently have a facility in South Stafford and in King George.
Thank you. One of the things that we've been hearing about is about our hospitalizations, and often people think those in the hospital are seniors, are the most at risk of being in the hospital. Can we talk a little bit about what we're seeing at the hospitals of who needs that level of care?
So we have a slide that shows the breakdown by age group. If we want to bring that up, I think that's a really helpful. So when you look at the slide, you'll see on the far left-hand side the cases by age group. And you can see that as you go across every age group in our district, this is in our health district, have been impacted by this disease. We're certainly seeing really high numbers in that 20 to 29, 30 to 39, et cetera, down. And in fact, some of our lowest numbers are in our older age groups, the 70 to 79 and 80 plus. And then I think if you look at the hospitalization, again, we have had hospitalizations in every single age group in our district. So this is our local data here, not national data, not state data, what's happening in your neighborhood. And we've had kids hospitalized. We've had senior citizens hospitalized. So I think there's a myth out there that only older people are hospitalized, and that's just not true. We do see individuals all across the age band that have very serious, very prolonged hospitalizations. And then that final graph over on the far right-hand side shows the age at that people were when they died of COVID. And again, it is primarily centered on those in the older age groups. But if you look, we've had deaths down in the 40 to 49-year-old age group, a really young age. So I think it's really important for people to understand that we have cases and hospitalizations and deaths spread across the age group. And I don't know if my colleagues want to comment about what they're seeing in the hospital and how this is impacting their staff when they have a young individual that just is having such difficulty breathing.
Yeah, Dr. Bonds, I think you covered that very, very well. I think, this data shows that there are hospitalizations in every single age group, right? And nobody is safe from COVID or safe from having requiring hospitalization to help them battle it. And so that's why we all need to take action now, right? And the other thing is, the deaths and the worse outcomes. When we stay within our capacity to provide care for every single individual and we're able to maximize that care, we get better health outcomes, right, for those patients. If we have a surge of patients, another 50 patients that show up tomorrow that require that high level of care, it becomes much more challenging for hospitals and health systems to do that. You see that's when hospitals get overwhelmed, like you saw in New York City, like you saw in Italy, other areas of the country where the system exceeds its capacity and becomes overwhelmed, and the deaths start to skyrocket because every patient can't get that high level of care. That's what we need to prevent in our community right now by taking action to flatten the curve. We need to keep the curve flat. We need to keep everything within our capacity to make sure everybody who's in our hospital can get the highest level of care. That's what we need to do.
Now, one of the questions that came in as a result of that is, do you recommend otherwise healthy folks who are under 65 but suspect that they might be ill with COVID-19 to stay home and recover? Or, if so, are we ever going to get to the point where we may have to turn people away who have COVID symptoms to prevent them from spreading to others?
Well, I advocate testing, even if, early on in the pandemic, we told people if they were sick to stay home because we were not able to test. We were barely able to test those sick enough to come into the hospital at the early stages. At this point, I think it's important to get a test so and you can protect others from getting sick. I find so many people that think, oh, I probably have a cold or it's allergies or this or that. And by the time they get tested, they've spread the disease to many different people, and some of those may be high risk or have a very bad outcome. So it's important to know, it's important to protect others.
That's great. Thank you. Dr. Bonds?
Yes. I just want to point out, too, that if you come to one of our testing events, it's very safe. We do it in your car. You're not out with a crowd of individuals. We try and make it as streamlined as possible so that we lower that risk of people infecting other individuals. So I would just echo Dr. Newman. If you are symptomatic, please come and get tested.
Yeah, thank you. I'd like to ask a clarifying question around mask wearing. A lot of folks are using homemade masks or maybe non-surgical masks, like I use my Mary Washington mask. And they're wondering, is it safe to keep reusing it? Should it be washed more frequently? What should we be thinking about? Are we contaminating ourselves by taking off and putting it back on?
I think the most important thing is to wear a mask and cover your respiratory organs. And if your mask is soiled or it needs to be laundered, launder your mask. Many of us have several masks that we rotate while others are being laundered. There are also pretty good availability now of these kind of poly masks, like level 1 kind of medical masks around, and they are in essence somewhat disposable when they get soiled, and you can swap those out. The most important thing is to wear a mask, and I know people, you don't. It's about limiting the spread of particles coming out from your respirations, and also limiting particles from entering in your breaths and providing some filtration. And I think any mask will do a better job of that than no mask for sure. Obviously, if they're visibly soiled, or you can launder them and do other things. The most important thing is to wear a mask when you're around others, even if it's the same mask all the time.
Yeah, I would echo that, and I would say that if you can either acquire or make enough of the cloth mask so that every day you can swap one out and put it through the laundry, that's really best practice. And I encourage people to actually put them in the dryer too, because that'll help kill off any remaining viral particles. The other thing that I would really encourage people is try not to touch the top of your mask. I see people all the time, and it's really hard not to want to pull on it. But that's the area that's contaminated, right, from the outside. So if you do that, make sure you clean your hands. And when you do take it on and off, try and take it off from the ear straps on the side.
Great advice, Dr. Bonds. Thank you. How long does it take to get test results, particularly for the drive-through test that the RAHD is doing? And then we could answer that same question for Mary Washington Healthcare, but how long does it take to get those results typically?
So typically it's at an outside 3 to 4 days. Sometimes we get them back in 2 days. It depends a little bit on what the state lab has in its queue to do. We use our state lab for the most part. And while they have great capacity, we could be one of 25 testing events that are going on across the state right now. So we tell people 3 to 4 days. Sometimes it's earlier than that. So that's why it's really important. If you're symptomatic and you're seeking testing, while you're waiting for the results back of that test, you really need to go home and put yourself into isolation to avoid spreading this disease.
So assume you have it till you know one way or the other.
Absolutely.
Great advice. Thank you. And how about vaccines? We're starting to get the vaccines question. What's happening with vaccines? Everybody's talking about it. What do we expect here in Virginia?
So we know that we'll be getting vaccine arriving sometime this month. Right now, what we're waiting for is the FDA to provide that emergency use authorization. They will be meeting to talk about vaccines in the next week or two. So I anticipate that certainly by the end of the month, should all of the safety data look good, we will be able to proceed with that. But I think it's really important for everyone to understand it's going to be a really limited supply to start with. We are trying to vaccinate not just everyone in our community, but everyone in the state and across the country and really across the world for this. So we have a tiering system. The CDC has set up a system where we're going to focus on those that are either at highest risk of contracting the disease or highest risk of having a bad outcome. So you see it here on the slide. Where we will be focusing first is on those healthcare workers that are at high risk of exposure. So all of the individuals working at Mary Washington Hospital in the COVID unit, for example. And then at the same time, we'll also be focusing on long-term care residents because we know that they have really poor outcomes and are at high risk of contracting this disease. And then you see the rest of the groups here. There's still a little bit of flux in how we're going to define an essential worker. And I don't really expect to be able to do high-risk individuals that are in the community, that Tier 1C, until after Christmas, New Year's, probably realistically more like February or March. But it's coming. We should be able to start this month, which is great news.
Yeah, Dr. Bonds, I think that it is great news, right? And we're doing a lot of preparations here, just like every hospital is in the Commonwealth of Virginia, getting ready to receive that vaccine and make it available to our personnel who are at risk. But another important point here for everybody listening is that there is light at the end of the tunnel now. When when we met and had these town halls back in the spring and early summer, there was no vaccine on the horizon, right? The actions we get, flattening this curve one more time right now, taking actions, doing it, like saying, okay, we're going to buckle up and do this. I'm going to limit my activities. I'm going to definitely wear a mask if I'm going to be around anybody else. Do this right now. We have light at the end of the tunnel with these vaccines right on the horizon coming out, right? And that's good news for all of us. There is a sense of hope and optimism, right? We can see that light at the end of the tunnel now. Back in the spring, we couldn't even see it. We didn't even have these things going through trials. They weren't available, but here they are right in front of us. And so let's all take action. We can do it one more time right now to flatten this curve. We have really high prevalence in our community. We can take actions to flatten it one more time. We have vaccines and other things on the horizon to help us get out of this long term, and they're right in front of us. And so I'm excited about that. I know a lot of others are too, but let's keep that in mind. We don't need to do this forever. We do need to do it right now, though, here in our community. One more time, all take action, flatten the curve.
As to testing, we do have someone who must have had a COVID-19 test, which can be somewhat unpleasant if you've ever experienced it, where they go pretty deep into the nose when you're getting that test. Are there other alternatives to testing for someone who might find that a little bit too uncomfortable, or should they just go with it?
That's what's standardly available in our community at this point. There are saliva tests and others that are located, like University of Virginia is doing saliva testing and others. But for the most part, it is the swabs that we are using for the PCR test here locally, at least in Mary Washington.
And that question of testing earlier about how long the turnaround time is, it is a little shorter for the patients that come into the hospital where we're wondering, do you have COVID or not? We have the ability to run in-house testing on those individuals when they're being admitted to the hospital, and that turnaround time is a matter of hours, right? In some of those cases, it can even be less than an hour to get test results back when they're done in-house. But we don't have the capacity to do that in the thousands every day for members of our community. But if you are sick and ill and we need to know right now, do you have COVID? We don't have to wait 2 or 3 days anymore for those results to come back. We have the ability to do some very high quality genetic PCR testing in our hospitals now.
Thank you for that. If somebody needs to travel, fly perhaps, what PPE should they even be thinking about? N95s or surgical masks are enough? Gloves, face shield, the whole 9 yards?
Why would you be traveling after what we just
I
spoke
knew you were going to
about,
say
right?
that.
Right? Why would you be contemplating that right now, right? Because we all should be taking action and staying home in our households and limiting our exposure and travel and unnecessary travel in any ways. And so I would encourage everybody to not be thinking about that right now, to talk about the actions we all need to take for one another to flatten the curve in our community. We can't have that slope going up like it's going up in those graphs. It needs to flatten out right now. And so, I think traveling with the high prevalence that we have around it's more dangerous now than it's ever been in COVID to do actions like that. It's more likely that people on those planes will have COVID now than at any point in time through the whole pandemic, because the prevalence is so high around our entire country right now, higher than, and it's so diffuse. It used to be hotspot here, hotspot there. They're seeing it there. Now our whole country's prevalence is increasing. That's a very, very dangerous thing. And so it's probably never been more risky to travel or to be on an airplane now than it's been at any point in the pandemic.
And many of the as you're talking about specific types of masks, many of those K95 masks that were actually imported from China have been found to be counterfeit. So you don't want to just lull yourself into a sense that you're safe with those. I would put those in the category as any standard mask at this point. It's very difficult to know which ones. As we were deliberating early in the pandemic, are these safe for our healthcare workers? The evidence was not great for those. And the standard N95 mask for healthcare workers, although we currently have an adequate supply for that, there's not a supply nationally for the community.
Thank you. As we have talked about our numbers increasing and more hospitalizations, is there reason to believe that we may end up changing our visitation policy?
We've already changed our visitation policy. So we've begun to limit, again, more so the people who are able to come into our facilities. And as this begins to ramp up, we'd expect more of that. So that's unfortunate. Nobody wants to be isolated if you're a patient in our hospital. And our care teams are always looking at this closely, because you're balancing the compassion and the needs of the patient and families, but also the safety of our patients and families and our staff. And safety is our number one priority here. And I will say, even with all the numbers and scary numbers that we're talking about at our hospitals are very, very safe. If you don't have COVID and you need care, please come. It is very safe. Mike and I come here every day, and we have air filtration systems, and everybody is masked, and we are taking enormous precautions. There's no reason, if you need medical care, that you should feel afraid to come to the hospital.
That's an important point, and it gets back again to the elective surgery or the scheduled procedures. So, people have medical needs, right? And we saw early on in the pandemic, people were delaying receiving care for medical needs that they had. And we saw increase in severity of illness and, worse health outcomes because of that delayed care. And so here we are at a point, another reason why we can all take action for one another is like, there's the baseline healthcare needs that a community has, and delaying those care needs doesn't lead to better health outcomes, right? And so we all need to take action now so that we have the capacity that when people have healthcare needs, that they can come get it and we can provide great care to them as well. It's not just all about COVID. People have heart attacks. There's lots of disease that happens all the time. We need to provide great care to those individuals so that they can have great health outcomes as well.
Thank you. We're getting close to the end of the program, so I'd like us to go with our closing remarks. Dr. Bonds, any advice for the holiday season as we get into the winter months in December?
Yeah, so I'm just going to echo what Dr. McDermott was saying. I think it's really important right now, in particular, that everyone stay home. I know it's really challenging. We love to see our family at this point in time, but I think we need to focus on keeping all of our friends and our neighbors safe. These are actions that you can do. These are things that you can do to help our entire community, to help your family, to help your friends. So I really am encouraging everyone to not travel. Don't get on that airplane. Stay home. Stay with your immediate household members. If you do have to go out to do your shopping, to go to the doctors, make sure that when you're out, you're wearing that cloth face covering or your mask. Make sure you're keeping your distance, washing your hands. And if you get sick, seek care. Come and get tested. We really want to know and make sure that people get the care they need.
Thank you. Dr. Newman, what advice do you have to offer to our community?
I want everybody here to think about our frontline providers and our first responders and what they've been doing for our community from the very beginning. Many of us have been working from home, living our lives. It's been not ideal by any means, but our first responders, our frontline staff have been putting their lives on the line. They are exhausted. They've been caring for this community. They've been going above and beyond for month and month and month on end without any break. So please think of them when you're taking actions, because again, we need to flatten the curve so that we prevent our health system from being overwhelmed. Get the flu shot if you haven't had it. Please mask, please social distance. This is serious at this point in our community.
Thank you. And Dr. McDermott, final remarks?
Well, I'd like to thank Dr. Bonds, our partners at the health department, for joining us tonight. We've been great partners really through this whole pandemic, helping our community navigate it. And thanks for joining us tonight. I want to thank everybody for tuning in, spending a little bit of their evening with us. And then my ask would be for everybody here to help us spread the word, right? Everybody here can talk to 3, 4, 5 others in your social networks. Of course, you're going to do it by telephone and not in person at this point in time. But you can spread the word and talk to others about how important it is right now in our community, for the health of our community, to take action now to help us flatten the curve. And so I would just ask everybody, please help us spread the word and spread the reach about the situation that we're in now, the steepness of the curve, and that our need to flatten the curve at this point in time as we head into the holiday season.
Thank you. And thank you to all our panelists and all of you for tuning in to our town hall. On the screen, we're going to go ahead and list again the free community testing for December. We have one tomorrow at Dixon Park on December 4th and Saturday, December 5th at King George Elementary, and 3 more next week. So please take advantage of the free testing supplied by the Rappahannock Area Health District. You can visit their website for details. If you are having symptoms and not sure where to seek care, you can always call our Mary Washington Healthcare free triage line. Our HealthLink nurses are available daily from 6 a.m. to midnight and can talk with you about your symptoms and offer care advice. Mary Washington Healthcare is planning to host weekly town halls throughout this month, so tune into our Facebook page next week on Thursday, December 10th at 6:30 for more updates on what's happening here in our community. As we continue through the holiday season, we ask that you please stay safe and healthy and have a good night.